This is the Dr. Don Show. It's your health, it's your life on the Astral Radio Network. Now, back to the show.
Welcome back on Labor Day weekend. We were just talking with one of our callers about some of the chronic problems, and this is a serious matter because I know that there's lots of people, over the age of 60 and 70 that have got chronic problems, and they're just told to live with them. Now, Michelle, let's give that number again, because for those people that are listening to us that don't drive, and they don't take the handy dart, members of the Massage Therapy Association will go to seniors and residences for help. So what's that number again?
It is 604-873-4467.
All right. So what else is going on there, Michelle? We talked off air about something else that I just casually thought about, and I think you need to bring this to the listeners' attention.
Yeah, so there was a spot there for Réseau Santé, which of course is an organization that we're affiliated with. And Anders, you said that you have some connection with them as well?
13 years of French immersion education have provided me an ability to communicate, albeit slowly and a bit disjointed, but I've found that there are certain French patients that if they feel that they're not quite confident coming to see an English-only speaking practitioner, that I am listed as part of the Réseau Santé network.
Terrific.
He even had that with the right accent,
yes,
too.
Yes, he certainly did. So, I mean, they provide a great service for, not just massage therapy, but an assortment of different health professionals that are, like yourself, French-speaking. So that's a great service, and it's encouraging that there's a lot of people on that network. Fantastic.
Definitely.
Congratulations, Anders. Well done. That's another part of your bio that I missed, but you're a man of great depth and surprise. So tell us about this voice dysfunction. What is voice dysfunction? How did you become interested in that?
As we've talked about, I'm a singer. And the one thing I wanted to do was find a way that singers and other people that use their voice could gain specific benefits from massage therapy. I'll spare the details of how I got into it, but the long and the short is I discovered that massage therapy in its different forms, specifically to the neck, the shoulders, and those other areas, can definitely help in addition to the normal treatments that people would get by seeing a speech pathologist or a vocal coach. And some things that I discovered were how muscle tension and muscle discomfort and stress can play into our vocal health.
Yeah.
And it's one of those things where the voice is something we use all the time. And because of that, we don't get a rest period very often. Unless we're dealing with strep throat and we're completely mute for a day or two, we're always using our voice. So many people don't ever get the chance to properly rest their voice if they've had an injury or if they've had some sort of dysfunction that's causing a problem.
Some people just don't want to rest their voice.
Some people just don't want to rest their voice.
They talk too much. No, I'm just kidding about that. We're dealing with this clinically. All right. So voice dysfunction, it can be quite an impediment in your work and your life. Mm-hmm. And what would be what would be your approach to a patient who had this? And let's say, are you working with any singers for obvious question?
I haven't had a chance to work with any of the singers, but I'm just getting back into my choirs, and I'm sure once I talk to them, I'll have tons of people to deal with. But the approach is to look at the three parts that make up voice production. And that is talking about pronunciation of the lips and the jaw, talking about breathing and the way that we breathe, because a lot of people don't breathe in an advantageous way. They're breathing from the chest, which doesn't give them as much air as they need to, and it strains a lot of our neck muscles.
Okay.
And lastly, we have voice production itself, where we talk about making sound from our throat.
Is this work potentially leading to some developmental help in children with speech impediments? Do you see that there's an aspect of your professional work that might assist this?
I wouldn't be surprised if it would help, but I would definitely be honest in saying that that's far beyond my purview. There's many other voice professionals in which they deal with children and adults of all stages, such as speech pathologists and speech therapists, that they've been dealing with that for people from childhood onwards.
Okay, but your work there is directly working with those tissues, and while the problem maybe have developmental origins that are in another area of expertise, it may or may not be such that you can help that, but or provide an assistance in that recovery process.
Absolutely.
All right.
It almost sounds like you could approach, if you are a professional or amateur singer, you could approach the way that you look at things almost like a professional or amateur athlete,
Absolutely.
where athletes seek a lot of benefit from providers such as yourself. It almost sounds like singers should be approaching a massage therapist for the exact same benefits.
And it's interesting that there are many singers or people who use their voice that are very protective about their voice because of how closely linked to their identity and their work that it can be. So it's definitely a confidence-based thing as well, where one has to be very confident in the way that they feel about the health of their voice before that they're willing to expose themselves to that. Because I'll admit, massage therapy on certain people, on certain conditions, can be a very vulnerable thing. And for something as essential and as crucial as our voice, it becomes much more important.
So this area, we would call this classically soft tissue. In other words, ligament, muscle, tendons, and all that.
Mm-hmm.
So your work and your colleagues' work with, in this case, the soft tissues, it would strike me that that's an absolutely logical thing that someone who's using their voice on a daily basis, or singers, for example, and they're finding some challenges, you'd want to be working with those soft tissues.
Absolutely. And the idea is to encourage those tissues to work as freely as they can and to work with as a minimal amount of tension and discomfort as they're using their voice and when they're not using their voice professionally. For example, making sure that they're not yelling or screaming too loud if they're at a rock concert in their spare time.
Yeah. Now, one of the other things that you got involved with was exercise, and this is something that every one of our listeners should do in some degree, some fashion whatsoever, whether it's 2 minutes a day or some organized event. And you've started Brazilian Jiu-Jitsu. Now, you've in part done that to get an understanding of the body mechanics and the functional aspects that your patients are presenting to you.
Mm-hmm.
So apart from the desire to benefit your own fitness and health, what's the connection here? What made you think of this?
The long story short is I am not a fan of repetitive exercise. I don't like the idea of going to the gym. It's too much effort for me.
Right.
I'm very much a knowledge-based person. So going and participating in a martial art in which mastery of the technique goes hand in hand with physical mastery of the technique is something that very sort of, it interested me very much so.
Now, Anders, one of the things I apologize, I should have done much earlier in the show tonight. Some of our listeners may want to reach you in the 3 different regions of the Lower Mainland you're in. We've discussed about the voice problems. We've discussed the sports issues and other aspects of massage therapy care. So which of your 3 centers, or all 3, do you want us to make reference? Because we will be putting on our show tonight. All of our shows are podcasts. People can come back to them anytime, whether it's 2 in the morning or 6 in the evening. And we're going to put on the contact information for the Massage Therapy Association of BC.
Mm-hmm.
For those of our listeners that can't get to a massage therapist, we're going to provide this number and remind them to contact your association for a referral from the association to someone to see them. Now, in terms of reaching you, how do people do that?
I think the easiest at this point is to actually reach me by email.
All right, email it is.
Email it is.
If you don't have an email, phone someone who does, and they'll be able to get a hold of Anders for you. So go ahead and give us that email address.
All right. So the email address is ANDERSLAURMT
Okay.
at gmail.com.
All right. That's Anders, ANDERSLAURMT, no spaces, dots, or anything else.
No
Just
spaces
put
or
all those
dots.
alphabetical letters together. ANDERS, LAURMT, registered massage therapist at gmail.com. And Michelle will have that on our podcast link after the program tonight as well.
Absolutely.
So what do you see next for yourself? I mean, you're only 2 years into practice. You're doing research. You've got already 2 niche chronic conditions that humans are suffering from. Obviously, you're going to develop more expertise in that. What else is interesting you?
Probably shouldn't. I think I'll mention this now. I'm also getting married next year.
Congratulations.
Oh, wow.
Thank you.
That will change your life
Absolutely.
for the better.
Absolutely. In
Like
terms
that?
of professional goals, one of which is to sort of get a good footing into my communities and making sure that the communities understand where we're coming from, where massage therapists
Yes, that's really
and
critical.
how crucial we can be to certain parts of their health in any capacity, physical or otherwise. barring that, the next thing I'd like to do is actually be involved a bit more with doing some research or some specific work with singers, and maybe eventually in 5 to 10 years being the go-to person in terms of massage therapists for people dealing with vocal dysfunctions. But I will be honest, that's a long-term goal, so you can check back with me in 5 to 10 years and see how well that turns out.
Well, Anders, you're early in your career. You're early in your life. You haven't yet got married, which will be just a wonderful life-altering experience for you, which will probably give you a few more, research areas that you haven't thought of yet to come along. So do you plan to stay working in 3 clinics in the Lower Mainland, or are you going to consolidate that?
I might consolidate, and if I do, I'll make sure that you're the first to know.
So what is it? Tell me, what is the interest in having 3 clinics, though? I'm kind of curious about that. It's like having 3 businesses and going to 3 places all the time.
I found that they were the ones that sort of offered me the best opportunities at the time in terms of balancing a healthy practice and having not too many eggs in one basket. I learned a long time ago that in some places, diversifying is a solid key to making sure that I'm not, hurting too much in between appointments.
Well, Anders, I want to thank you very much for coming on the program tonight. You represented the BC Massage Therapy Association extremely well. You represented your practice and clinical expertise very, very well tonight. And I know that the listeners got a lot out of our discussion tonight. I think some of them will sit there and start to rethink some of their issues like our caller did. And hopefully our caller's experience will prompt other people to think about, gee, I'm on a single track here. This track is just constantly going on and on and on every day over and over and over again. And we remind listeners that they have to take control of their health. They have to look for information. They need to call us and ask us for advice or contact reference points as well. So you did a great job, and thanks for being on the show tonight.
Thanks for having us.
We'll follow your career for sure.
Muchly appreciated.
So, Michelle, as we wrap up, what do we remind now on Thursday nights? Every Thursday, we're doing Empowered Health, which we can tell listeners is a repeat. So if you saw us over the last 6 months, January to July, I'm sure there's a few episodes you missed. So listen every Monday night. Every Monday night, you
Yes.
got to listen to us to hear at AM 650 on the Dr. Don Show. And Thursday nights at 7 p.m. It's on Check TV. It's Empowered Health.
That's correct. Yeah. So the repeats are playing, and you can also catch all of the repeats of the Your Spine, Your Health segment from that show on YouTube.
And it is important because that message is about you have a back. It's kind of funny to say it that way, but trust me, if you don't get up tomorrow morning, you've got excruciating pain, you look in the mirror to brush your teeth, the last thing you're not even going to say, gosh, I think my 4th lumbar hurts. So that's just not going to happen. Anyway, for more information on tonight's program, massagetherapy.bc.ca. And if you want to get the hold of the exercise sheet, it's radio@bcchiro.com. And as always, our Bible on Reform, Squandering Billions, Healthcare in Canada. Just email us for a copy, radio@bcchiro.com. I'm Dr. Don, joined by Michelle in the studio, and of course our producer, Adam Graham. Thanks for listening. Thanks, Anders, for being here. Join us next Monday at 6 on the AM 650 show. On the next show, private healthcare. What do you think? I'm Dr. Don, encouraging you to make informed choices. Good night, Gary.
The Dr. Don Show. It's your health, it's your life on the Astral Radio Network.
Admit it, your body hasn't exactly been running like a well-oiled machine lately, has it? Don't put up with aches and pains. Find a registered massage therapist. Whether you're suffering from pain due to an auto accident, workplace, or sports injury, your one-on-one therapy is a clinical approach to pain relief of the soft tissue and joints that can also be used for injury prevention. Find a registered massage therapist online at massagetherapy.bc.ca. A message from the Massage Therapists Association of British Columbia.
The proceeding was a special advertising feature on AM 650.
You can win on Facebook.